most people do not realize they have chronic inflammation until they develop a bigger health issue and disease. Again, it could be diabetes, it could be heart disease, it could be cancer, it could be an autoimmune disease. There's a wide variety of different diseases that come from chronic inflammation, but often people do not realize that until they actually have the disease.
Welcome to Thriving with Diabetes, the podcast where we empower people with type 2 diabetes. I am your host, Gamden, a holistic wellness coach, helping people overcome challenges related to type 2 diabetes. I have dedicated my passion for health and wellness to helping people like you navigate the complexities of diabetes. I believe that with the correct knowledge, mindset, and support, you can manage your health condition and live a fulfilling life. In this episode of Thriving with Diabetes, we are talking about chronic inflammation. We have a great guest who is dedicated over 20 years to public health and health coaching. Our guest, Rafael Fernandez, brings his knowledge and experience specifically in addressing chronic inflammation. Rafael has noticed a growing awareness of health issues related to chronic inflammation, promoting him to give his full attention to health coaching. Rafael will guide us through identifying early signs, diagnostic methods, and practical strategies, integrating lifestyle changes, dietary approaches, and supplement strategies for overall health and diabetes. I'm so excited to have our special guest with me today, Rafael. So it is always inspiring to learn about our guests' perspectives and experiences. And before we dive into our discussion, I would love for Rafael to introduce himself, share something about him and his background. So without further ado, I will hand it over to Rafael to introduce himself. Rafael, welcome to Thriving with Diabetes podcast.
Thank you, Gamdan. It's a pleasure to be here with you. I think this is a really important topic to speak of, and I've sort of dedicated my life to trying to educate people about disease prevention. And as you've mentioned, I've worked over 20 years in the field of public health, specifically as an epidemiologist. So I started my health career back, as I mentioned, over 20 years ago. Now, actually, it's probably over 30 years as a personal trainer. So I was a fitness trainer, helping people get in shape, helping them lose fat, gain muscle. And, that was like very personal to me because I was always interested as a young boy in sort of health and sports and things of that sort. And I wanted to sort of help other people. So that's why I started as a personal trainer. And after years of doing that for some time, I wanted to learn more and just like further my career. So I went to university and got my master's in public health. And as I mentioned, became an epidemiologist and working specifically in disease prevention, but acute disease. So I started in the New York City Department of Health, working in the Bureau of Tuberculosis, so helping patients that had tuberculosis. Then I moved on to the Bureau of Communicable Diseases, where I was working with 70 other communicable diseases. So again, these were mostly acute disease. And I sort of really enjoyed doing that for some time. It was very interesting as I worked with like diseases such as Ebola, West Nile virus, MERS, SARS, bird flu, swine flu, all of these different diseases. And I was able to learn a lot about how people got infected with these diseases. And then I sort of moved on and worked in several hospitals in infection control. So now I was dealing with, again, acute disease, but a little bit different in like it was healthcare associated diseases. So diseases that hospital patients were acquiring while they were in the hospital. So these were like infectious such as MRSA, sort of antibiotic resistant infections. I did that for several years at like public and private hospitals. Then I moved on to start my own business. I actually was always very interested in starting my own business, so I started a fitness business. And again, helping people get in shape, gain muscle, lose fat through diet strategies. And I just kept learning more and more about the body and sort of how to really help people more effectively lose fat and gain muscle, because this is extremely important for a lot of different diseases. So not only acute disease, but chronic disease, such as diabetes, cancer, heart disease, things of that sort. And I did that for several years, and I really enjoyed it. But, working in your own business is sort of very stressful. And I was like working by myself for that time. I didn't have any other partners or anyone else to help me with the business. So I got a little burnt out doing that for a while. And, my own health was sort of being compromised because I was not paying enough attention to it. And I started to learn how important not only diet and fitness was to your health, but lifestyle, right? So, my lifestyle working in a business was being, as I mentioned, compromised because I was under a lot of stress. I wasn't sleeping well. I was focusing on just the business itself. And after several years, I had to move on from the business, unfortunately, as I was, not paying attention to my own health. So I went back into public health, and I was working as a consultant for some time. And then I went back into public health, working with the New Jersey Department of Health, specifically with COVID, when COVID started, and I did that for some time. And, I started to sort of think about more about chronic disease, specifically with myself. It was heart disease, so I had to get heart surgery during that time. It was, I didn't realize it, but I had a heart aneurysm that I had to repair. And so that was the purpose of the surgery. So I had to have that done. And I was out of work for quite some time and recovering from that. Again, sort of wasn't paying attention to my own health. I had gained some weight. I wasn't exercising consistently. I wasn't watching my diet. And lifestyle, again, was a big part of it. I wasn't sleeping well. So, after some time, I decided I needed to take care of my own health. And that's when I started on this journey of chronic inflammation and learning more about that specifically with myself. and needing to address that, although I didn't realize it at the time that I had chronic inflammation. And I think that's a big part of the problem, is that most people do not realize they have chronic inflammation until they develop a bigger health issue and disease. Again, it could be diabetes, it could be heart disease, it could be cancer, it could be an autoimmune disease. There's a wide variety of different diseases that come from chronic inflammation, but often people do not realize that until they actually have the disease. And that's what I want to help people do, is to sort of realize the importance of dealing with chronic inflammation, how they can identify that they have chronic inflammation and address it before they develop the disease.
Brilliant. Very interesting story, and it's a long journey to go through all of these. So from being a personal trainer to studying about health or public health, you focused on acute diseases, then you progress to having a business, then you suffered from health issues that or maybe stress related to work, lack of healthy lifestyle. Then finally you end up, or you manage to start focusing on chronic inflammation as your mission right now. Is that correct?
Yes, you got it. That's exactly right. And, again, I want to emphasize the importance of chronic inflammation. So just that your audience understands the impact of chronic inflammation, we don't have specific statistics on how many people suffer from chronic inflammation, right? Because it's very difficult to, again, know if you have chronic inflammation, and there is no specific diagnosis for chronic inflammation, right? But what I can say is that chronic disease is extremely important and has a really large impact, right? So, the statistics for chronic disease is that 3 out of 5 people, around that amount, suffer from a chronic disease, whether that's whether that's cancer, heart disease, diabetes, an autoimmune disease like lupus, rheumatoid arthritis, also neurodegenerative diseases such as Alzheimer's, right? Then you have sort of depression, which is extremely a large impact. All of these things can be related to chronic inflammation. And so I believe that probably 80 to 90% of the population suffers from chronic inflammation. Think about that. You're talking about, 8 to 9 out of 10 people have some level of chronic inflammation. And I feel so confident that, this is an accurate number. I also believe that most of us, all of us, at some point in our life suffers from some level of chronic inflammation. And, that included me. I suffered from chronic inflammation. And, everyone, because of the lifestyle that we live in today's world, again, has some form, a level of chronic inflammation, whether that's a very low level of chronic inflammation, and we don't really think much of it, or it can be a high level of chronic inflammation where it greatly impacts our everyday life.
Very interesting. And That sounds like a warning for everyone when about 80% will have a sort of inflammation. But before we go deep talking about chronic inflammation, we need just to explain or give some basic definition for a chronic inflammation, so our viewers and listeners understand what a chronic inflammation is.
Yes, so let's start first with acute inflammation, right? There's difference between acute and chronic, right? And so most people will be very familiar with acute inflammation. So acute inflammation occurs when we experience some sort of health event. Okay, so that can be a major health event, or it can be a minor health event. So anything like, let's say you get sick. So that's sort of, a lot of people understand when they get sick with some sort of infection, and that can be, something like a cold. You sort of pick up a virus and you just develop a cold and you have symptoms like a headache, just general symptoms of a cold. Or it could be like the flu, right? You get, the flu virus and you develop sort of that type of infection. Or another example could be just like, you break an arm or break a leg or something like that, or you have some sort of accident that occurs. That is an acute event that happens in your body, and your body will respond to that event in many different ways, right? So there can be very specific symptoms. So again, if you have the flu, for example, you're going to develop these symptoms like a headache, body aches, a fever, right? These are all sort of symptoms related to the flu, and internally as well, right? What happens internally when you develop an infection like the flu is that your body responds to fight that virus by increasing the number of white blood cells, right? So your white blood cells sort of increase so that they can fight off that flu virus, right? And the same thing happens similarly, like if you have some sort of trauma, like a broken arm, a broken leg, or something like that. There's a specific response to that event as well. And that's sort of healthy. That's fine, right? That's what you want your body to do, because that's how you get over that event, right? That's sort of your body's natural response to getting over that event. Now, when it comes to chronic inflammation, those same things happen that I previously mentioned, internally as well as sort of externally. Your body responds externally, but it sort of stays, it's a prolonged response. So where an acute inflammation is sort of over in about a week or two, depending on what it's responding to, chronic inflammation stays for months and sometimes years, right? So again, your body is responding to that. It can be an event like an infection, and internally, you have elevated white blood cells, right? And that stays elevated for months and years. And it's not only white blood cells. So there's other things that are also elevated, other pro-inflammatory sort of chemicals like proteins and things of that sort, where we won't get sort of very technical and involved with that. But there's a host of different chemicals in your body that stay elevated for a long time. And that is not good, right? You sort of don't want those things elevated because that creates a lot of other health issues in your body, along with, so, those issues, a lot of people are not aware, right? So you don't know that you have these elevated issues inside of your body, but then there can be other symptoms related to that as well, and that can go on for months and years, and that can be a variety of symptoms, whether it's gut issues, it can be brain issues, it could be joint issues, and related to diabetes, it can be blood sugar issues that goes on for sort of months and years. And again, the main thing is that people don't realize that they have these issues, or they might know that something is not right, but they don't think it's very important and they don't deal with them.
Brilliant. Thank you for sharing these great insights. So just to summarize it, so if I got it right, a chronic inflammation usually stays for about maybe month or years. But when the acute inflammation is a temporary response by the body, which is normal or natural.
Yes, correct.
Brilliant. That's very interesting. And this will lead us to the next step. We want to talk about chronic inflammation and diabetes. Many might not realize the profound connection between chronic inflammation and diabetes. Could you explain how chronic inflammation can impact diabetes management?
Yes. So diabetes, so we have to, of course, distinguish between type 1 diabetes and type 2 diabetes, right? So type 1 diabetes is usually something that that you have from an early age. You can develop it at a later age, but usually it's at a young age. And, for the most part, it is a genetic disease, but it is also an autoimmune disease where your pancreas is just not developing enough insulin, right? And that's the problem sort of with diabetes, and you have to take insulin, every day for the most part. Now, type 2 diabetes is sort of a bigger problem, I believe, because most people develop that at a later stage of their life. Although now we're starting to see younger people develop type 2 diabetes, right? And what people have to understand is that diabetes, whether it's type 1 or type 2, is an inflammatory disease. So type 2 diabetes mostly is inflammatory disease. And this is interesting because I just learned this myself, that way back in the 19th century, they started to use aspirin as sort of, when they sort of discovered aspirin, and they found that it was very effective in helping type 2 diabetes. And why was that? Was because aspirin is an anti-inflammatory, right? And, sort of that was found to be effective, and they found the connection that, type 2 diabetes, as I mentioned, is an inflammatory disease. And what happens is that, most people that develop type 2 diabetes, it's related to their diet, right? They don't have an optimal diet, because they're eating a lot of grains and sugar and things of that sort. But also, they, for the most part, are overweight or obese, right? And this is the problem, is that when you are overweight or obese, you start to, your body starts to produce these I mentioned earlier, pro-inflammatory chemicals inside of your body, and you're not aware of that, right? You sort of don't realize that your body is producing these chemicals, which then can lead to insulin resistance, right? And this is the problem with type 2 diabetes, is that your body is just, your insulin is not functioning properly, right? And so your body has to produce more and more insulin. And that's what happens, with insulin resistance, right? Is sort of your insulin is resistant and sort of is not sort of doing what it should be doing in response to sugar. And so you have a lot more insulin in your body. And when your body produces a lot more insulin, that's when you start to develop type 2 diabetes.
Brilliant. Thank you for sharing this information. And I think recognizing early signs of chronic inflammation is crucial. What are some common indicators that our viewers and listeners should be aware of, and how might these symptoms manifest in their daily lives?
Yes, so it can vary, right? So this is the problem as well, is that with chronic inflammation, as I mentioned earlier, it can affect all parts of your body for the most part. So, from your brain to your gut to your joints to your skin, all of these things, you can develop symptoms related to that, right? So if we're talking, let's talk specifically about your brain, you might have symptoms such as brain fog, right? You're not able to focus or concentrate, or maybe you don't remember things as well. You sort of, just don't feel right. And this is the problem, is that a lot of these symptoms can be very sort of benign, and you don't think much of them, right? And you experience them for a long period of time, right? If you might sort of not be able to remember things from day to day, that's not a big issue. But if that continues over time, months and years, that is a problem, right? When we're talking about your gut, right, you can have, again, sort of benign symptoms like gas, for example. You eat something and you develop a lot of gas. You don't think much of it from day to day, but over time, again, that is a problem. You sort of have maybe indigestion, right? A lot of people, it could be just when you eat certain foods and you just develop indigestion. A common food is like maybe wheat products, right? When somebody, or dairy, somebody eats these things over and over and over, and they develop these gut issues, but they don't think much of it, and they just continue to eat these foods. That can turn into chronic inflammation. Or again, it could be skin. Maybe you have a rash, right, that you don't think much of, but you continue to have this rash over time, weeks and months, and again, you don't think much of it. And then related to diabetes, blood sugar, right? So you have constantly elevated blood sugar, but you don't know that you have it unless you're testing yourself, right? So this is the problem. You don't realize you have elevated blood sugar, usually until you develop a secondary problem. And then you go to your doctor and you realize, your insulin is elevated. Or lastly, the big one that I want to mention is weight problem, right? So you're overweight and you're obese, and usually people don't think much of it, but they want to lose this weight, right? For whatever reason, maybe they have a big event that they want to go to and they want to lose this weight, or they've been trying to, go to the gym for a long time and they're just having a very difficult time losing weight. And when we say weight, right, we want to really make the significance of fat, right? That's what people want to lose or should want to lose is fat. You don't want to lose muscle, right? You want to lose your fat. But then again, they're not able to because they've developed insulin resistance, which is related to chronic inflammation. So these are the outward sort of symptoms that people realize. But then, as I mentioned, internally, there's a lot of other biomarkers that are related to chronic inflammation, which are also important to address. And usually, or you do have to go to a doctor. You can get home tests that can sort of give you an idea of what these biomarkers are, but it's best to go to a doctor, an experienced doctor that can help you sort of identify these specific tests that should be done related to chronic inflammation.
Very interesting. Thank you for sharing some of the symptoms that we can experience in our life. You mentioned brain fog, bloating, and when the body reacts to something like a rash, or when we experience sort of body reaction or a skin reaction. And now we know what chronic inflammation is, some of the symptoms, and how it can impact our health. Let's look into practical strategies so to reduce chronic inflammation effectively, and what changes or lifestyle changes should we implement?
Yeah, so it's very important to start with lifestyle, as you mentioned, because I believe that's sort of the basic level that we all need to address. And especially in today's world, lifestyle is extremely important, and there are a lot of issues related to that we all experience, right? And I think that goes back to why I mentioned such a high percentage of people, 80 to 90% of people have some form or level of chronic inflammation. It's because of lifestyle, right? So, first and foremost, I want to start with sleep, right? So that is sort of extremely important, and something that, many times we suffer with sleep and we don't get adequate sleep on a daily consistent basis, right? So, we all should be trying to sleep, I believe, 7 to 8 hours every night. Again, consistent, well-rested sleep. But that can be impacted by a variety of things. And again, related to lifestyle is stress management, right? Which is extremely important, and related to sort of sleep as well as chronic inflammation. So even if you're sleeping well, but you still have stress in your life, that can sort of develop into chronic inflammation over time. So, we have to make sure that we sleep well. And what you can do is very important to have a routine, right? You want to have a very consistent routine of sleep where you go to sleep at a regular time every day, and you sort of wake up at a regular time every day. So everybody's going to be different based on their own schedule, but this is related to your circadian rhythm, right? This is our natural rhythm that our body has every day, that it just, your body likes to stick to a rhythm of, going to sleep and waking up every day. And I think, again, whatever that might be, as long as you're able to get 7 to 8 hours, that's what you're aiming for. And again, it's very important to also connect that to stress and stress management, right? So you have to, whatever way that you can sort of pick to sort of manage with stress, and that this can be like meditation. It can be sort of your environment that you live in is very important to stress management. Exercise is really important to stress management, and something we'll get into a little bit later on, specifically related to exercise. But these are all important things. And the last thing I will also connect to lifestyle is your environment, right? So as I mentioned, environment, where you live is very important to sort of chronic inflammation. Like the toxins that you're exposed to are extremely important, whether that's the air you breathe, also the water that you drink. You want to make sure that you're drinking filtered water wherever you live, but depending on where you can live, it can have a greater impact on that as well. But these things are important to sort of address. First is your lifestyle, and then we can move on to diet after that. But if you have sort of anything you want to add to lifestyle.
Brilliant. Very interesting. The lifestyle changes that we should follow or implement to reduce chronic inflammation. You mentioned sleep, and we should sleep at the right, on a specific time, and wake up at a specific time to regulate our body. So the internal clock helps us with sleep. We need deep and quality sleep. Second thing, you mentioned stress and some coping mechanism, such as meditation or physical activities. And physical activities itself, very important. And the last thing you mentioned is about, do you have a toxic environment or not? I know this is a big topic to talk about. It's about the level of toxicity is going to be different from place to another, but this is something we should keep in mind. What is around us can affect us. Is not just about food or drink.
Yeah.
So maybe if you can touch something about dietary or diet and nutrition, and about physical activity as well.
Yeah, just to sort of put a bow on lifestyle, a couple other things related to sleep is, not only the routine, but, when it comes to your environment where you sleep, you want to make sure it's very dark environment, right? So that's important as well. You don't want a lot of lights to be around. An exposure to blue light is extremely important to sleep, because that can affect the release of melatonin, which helps you sleep, right? Melatonin is a hormone in our body that's also related to chronic inflammation, actually. But when it's dark, your body releases melatonin, and also blue light from either your TV or your phone can inhibit the release of melatonin. So you want to make sure you cut those out. And lastly, the temperature, right? So you want it to be fairly cool in your room when you're sleeping, right? If it's too warm, then it sort of impacts your sleep as well. And then related to your environment and toxins, yeah, I mentioned sort of the food, your water, the air, but the last one that's really important is people. People can be very toxic, so you want to be careful with that as well, the people around you, because that's, I feel, another part that people may not mention, but can be really toxic, right? So now, once you have your lifestyle, diet, right? So diet is extremely important as well when it comes to chronic inflammation and diabetes and of course insulin resistance, right? So apart from the toxins, which I mentioned earlier already, you want to be careful with the foods you eat. Try to get organic foods as much as possible, because that sort of may not, a lot of people may think that it eliminates all toxins, but it may not eliminate all toxins, but most of toxins if you buy organic, if you're able to. And specifically, that sort of comes to like the meats. If you eat meats, you want to sort of, again, get organic, because that will reduce the amount of sort of antibiotics and hormones that are allowed in meats that you eat. And also with vegetables, right? So a lot of fruits and vegetables can have toxins related to pesticides and herbicides. So if you buy organic, you sort of reduce the amount of those toxins in there. But specifically, I help my clients, depending on their sort of culture. I like to personalize their diet as much as possible, because everybody is different, right, on their culture and their background, and whether they're a vegetarian or not, but also what they have access to, right? Not everybody may have access to certain foods depending on where they live, but for the most part, I think what I like to do anyway is sort of address their diet in specific ways, and that can be by increasing their protein intake, right? So I think that this is extremely important, and a lot of people don't eat enough protein in their diet. And why this is important? For several reasons. Protein is important for stabilizing your blood sugar, right? So related to insulin resistance and diabetes, when you eat protein, it doesn't sort of raise your blood sugar as much, of course, as carbohydrates, right? And also, it doesn't have as much calories per gram as fats, right? Although fats can also stabilize your blood sugar, protein, unlike fats, has 4 calories per gram, as opposed to fat, which has 9 calories per gram, right? So that's important to keep in mind, to keep your calorie intake at a lower level. And it's very difficult to overeat protein, right? When you eat a protein-rich food, unlike carbohydrates, you can eat a lot of carbohydrates and not really realize it. And even fats, again, because they have more calories per gram, you can sort of eat the same amount of fat and protein, but get a lot more calories when you eat fat. And this is the problem a lot of times when people maybe follow a keto diet, which is a high-fat diet. And though it's helpful for sort of insulin resistance and, can help you lose weight as well, sometimes people can overeat because they're just eating too much fat. With protein, that's kind of difficult to do. And last about protein, I will say, is that when you eat protein, your body sort of burns more calories in trying to digest that protein. So in addition to protein, very important as well is increasing your fiber. Fiber is just really important when it comes to your gut health, right? Fiber helps feed a lot of the bacteria in our gut. And a lot of people with insulin resistance and or that they're overweight, they might have, dysbiosis in their gut, which means that there's an imbalance between the friendly bacteria in your gut, and that can impact sort of your the way your body metabolizes or breaks down sugar, and also your body's ability to burn fat and lose fat. And the last thing I'll mention, of course, is your carbohydrates. I'm not saying that you should eliminate all carbohydrates. I don't think that you need to do that, and that is effective. It can be effective, again, if you follow sort of a keto diet, but I believe that that is not sustainable. You can follow a keto diet for some time, and it can help you lose weight and also deal with insulin resistance, but it's very difficult for people to follow a keto diet for a very sustainable time period. So I believe that you should include carbohydrates, specifically fruit and vegetables, which also includes fiber in there as well.
Brilliant. Very interesting information. There are a lot to digest, overloaded with helpful information from sleep to diet. Very interesting. I wanted to ask you about supplement. If you want to say something about supplement that can help with chronic inflammation.
Yeah, so supplements is a huge field, as we all know, in today's world. And I believe, I'm a big believer in supplements. There are many people that don't believe in vitamins and supplements. They think that, your body just doesn't use it and it's a waste of money. I don't think so. And it does depend on the supplement that you take. And there's so many, as I mentioned, but I will just mention a few of them. And when I work with clients, again, I take a personalized approach. I look at, sort of what they're doing every day, how they're eating, what their lifestyle is, and I make recommendations based on that. But probably three of the most important supplements I will mention in the interest of time. Number one is omega-3 fatty acids, right? I think when it comes to inflammation, you just have to make sure that you're getting sufficient amount of omega-3 fatty acids. And, sort of that can be difficult for a lot of people to get sufficient amounts in their diet. And that's why most people need to supplement with them. As well as it's very important to have the correct balance of omega-3 fatty acids. So even if you're getting an intake, you believe, of sufficient omega-3 fatty acids, you want to keep the correct balance, which is more important when it comes to omega-3 and omega-6, right? So most people get enough of omega-6 fatty acids in their diet, but when you get too much of omega-6 or not the right balance, that can create sort of chronic inflammation or can be pro-inflammatory in the body. Just to give an example, most people, have an incorrect balance where they get too much omega-6 in their body, and it's compared to omega-3, it's like 20 to 1 or, can be as high as 50 to 1. But you want to sort of bring that down, closer to like 6 to 1, or 6 omega-6, or maybe 3 omega-6 to 1 omega-3, right? 3-to-1 or 6-to-1, and you can get tested, right? So if you're not most people are not going to know what their balance of omega-6 to omega-3 is, so you should get a test for that. Now, going back to omega-3, where do you get it? It's usually through fatty fish, right? Seafood, salmon, sardines, herring, trout, things of that sort. If you don't eat fish and you're a vegetarian, there are vegetarian sources. Algae, you can get walnuts, chia seeds, flax seeds, things of that sort. All right. It's a little more difficult, but you can still get it if you're a vegetarian. But again, if not, I recommend most people supplement with a good fish oil. Or again, if you're vegetarian, there are algae that you can take as well. Now, the second supplement is vitamin D. Very important. Most people are deficient in vitamin D. Again, you should get tested if you don't know what your levels of vitamin D are. And the number one source of vitamin D is the sun, right? I believe that's where you should try to get vitamin D, is through the sun. And again, this is related to the sun is related to melatonin, as I mentioned earlier, and sleep as well. But again, if you're deficient in vitamin D, you can take vitamin D supplements. And everyone, again, this is an area where a lot of practitioners, doctors and maybe other health coaches, they recommend vitamin D, but you should try to always take vitamin K with your vitamin D as well, because they work together. And lastly, I will mention turmeric or curcumin, right? So, this is an extremely important, most people know turmeric as a spice and curry and things of that sort. But you can also take it as a supplement, as curcumin, and it's extremely effective supplement that's anti-inflammatory. And unless you're eating a lot of curry in your diet and getting a lot of turmeric, most people can benefit from a supplement that has curcumin in it as well.
Very interesting. Thank you for sharing this information about food supplement. Great. You mentioned omega-3 and the balance between omega-3 and 6. You mentioned the importance of vitamin D and how to get it. And the last thing you talked about turmeric, and when we use turmeric, I think we should include pepper to help with absorption. Now we come to the end of this episode, and I have got another question before we finish this episode. What inspiring message or advice would you like to leave with our viewers and listeners, specifically those struggling with type 2 diabetes?
Yeah, so, as I mentioned, diabetes is an inflammatory disease. I think that's first and foremost important for everyone to realize. And again, it's all about prevention. I really want to sort of emphasize this to people, because people don't think about prevention, and they sort of address the problem like diabetes when they already have it. So you want to sort of try to address this before you develop the disease. And how you can do this is, if you see that you're having symptoms like, you have low energy consistently, right? Because that can be related to insulin and the foods you're eating and blood sugar, or you have trouble losing weight, right? You sort of have for many, many years, you've been dieting, you're exercising, and you're just like having trouble losing. Again, fat is really what we're talking about, especially if you have fat around your abdomen area, because that is sort of the most detrimental part of your body that you can have fat, which is called visceral fat. You want to address that right away and go to your doctor. Get your insulin levels tested, right? Find out if you have trouble or you have consistently elevated insulin levels, and then sort of exercise is right related to that. Make sure you're doing the correct exercise. You want to be doing some sort of strength training exercise, right, to build muscle, which helps you increase the sensitivity of your insulin levels. So that's really important. But including, low intensity exercise as well as high intensity exercise. And I have developed my own personal program where I call it the 20-10-10-2, right? So what that means is 20 grams of protein, 10 sort of amount of fiber that you add to that, and you want that to be either insoluble or soluble fiber. The next 10 is sort of high intensity exercise, 10 minutes of that. And then finally 2 is at least 2 times per week. So again, 20, 10, 10, 2. And I sort of help my clients sort of with that specific system that I've developed, and I've seen great results with that. And I want to offer your audience, Gamdan, anybody that sort of you refer to me or that's interested in learning more, I can try to help them and offer a free 20-minute consultation to see if there's a good fit for me working with them and helping them with any type of chronic inflammation, but specifically insulin resistance and prevention of diabetes.
Brilliant. Thank you for sharing this inspiring message with some tips as well. How can people find you if they want to get in touch with you or learn more about you and what you do?
Yeah, so I'm on Facebook, Rafael Fernandez. They can find me on Facebook. I'm also on LinkedIn as well. Those are the 2 most common social media platforms. And lastly, again, if they are interested in the free 20-minute consultation that I offer, they can email me directly at Rafael, Rafael, wellness @gmail.com, or they can sort of reach out to you directly as well, and you can refer them to me.
Brilliant. Thank you for sharing your contact information as well. First and foremost, I would like to express my sincere gratitude for our amazing guest, Rafael Fernandez, for generously sharing his expertise, insights, and time with us today. I want also to thank every one of you, our dedicated viewers and listeners, for being a part of this episode. If you are seeking additional guidance and support on your health journey, I encourage you to book a discovery call with me at wellnessimpact.org. During this call, we can discuss your challenges and explore how I can provide a personalized assistance. If you found today's episode insightful and valuable, I invite you to join our community of people committed to thriving with diabetes. To stay up to date for upcoming episodes, empowering discussions, and practical tips, make sure to subscribe to our YouTube channel. For those who prefer other platforms such as Spotify, you can follow the Thriving with Diabetes podcast. Once again, thank you, Rafael, for being our guest today. Thank you, everyone, for joining us in this impactful journey. Until next time, take care of your health and keep thriving.